I am so tired. I just want things to go back to normal. Surgery is just one tool. It's time to put the other tools in the toolbox because it's your body, your health, your life. Is it the pandemic aftermath or is it the weight loss surgery recovery? The reality is, I'm just tired. I'm just finding it sometimes harder and harder to overcome the hardships and the demands of life without kind of getting into a negative cycle. In this video, we're going to talk about a phenomenon called the pandemic flux syndrome and how that relates to our experiences post bariatric surgery. For some of us, the healing phase post weight loss surgery, which by the way can take up to 6 months or longer, is just plain tough. And it can actually have a huge emotional impact on us and our lives, just like the pandemic did. And depending on what time you're watching this video, maybe that's happening at the same time for you. We're going to talk about some ways supported in brain science to help you move through this and start rebuilding. And sometimes putting a name to that emotion is helpful, or to help us understand the stress, as it is important to place it and label it. This is the work from many, but to give it full credit, the pandemic flux syndrome was coined by two people, Brene Brown, which I'm sure a lot of you are familiar with, and Amy Cuddy. So what is pandemic flux syndrome? Being in flux takes a mental toll. It exaggerates feelings like pandemic fatigue, mental fog, endless weight, kind of that work-life blur. Like the cases throughout the pandemic, we've all been in a state of flux this last year to 18 months. That flux might ebb and flow depending on the surges of the virus and what area you live in. We've come a long way from the beginning, but it's still not clear when this back and forth will actually end. And on top of that, we've had this kind of ever-changing, always changing guidelines and uncertainty kind of have brought up and is the reason why they coined it a pandemic flux syndrome. So the result of this pandemic waxing and waning, it's kind of like whiplash, like experiencing all these different kinds of emotions with no kind of clear understanding or knowing of when it's going to end. There's also been a big increase in depression, anxiety, feelings of numbness, as many of us kind of are starting to realize that this kind of pandemic or this new normal might never go away. There likely will not be this kind of parade that says, hooray, the pandemic is officially over. This kind of makes it harder for us to process and kind of move on from something that's kind of still ongoing. So now let's compare this to maybe our first few months post bariatric surgery, or maybe even a longer down the road. Some of us have a real hard time seeing the end. And we go back and forth with what our body accepts or rejects, our fluctuations with weight, the surges of side effects, and maybe even some of us are suffering from some of the complications. For some of us, our moods have changed, or they're going up and down. Our energy levels have changed. Sometimes they've even plummeted, and for a lot of times, we're kind of stuck in this survival mode. Just even as simple as trying not to vomit that day. One of the reasons we feel like this, they reference it in the pandemic flux syndrome, but also you can compare it to you after bariatric surgery, is because our surge capacity is depleted. Essentially, your surge capacity is what gets you through those bursts of stress. It is the flood of hormones and the physical changes that are happening to our body when you enter that fight, flight, freeze mode. However, our bodies were designed to undergo stress, but only for short periods of time. As Dr. Cuddy says, natural disasters and crises have an end. But for the pandemic, there has been no real official end. We can't even imagine one, really. So it's very difficult to get closure, kind of work through the grief when you've been in a crisis for 18 months or longer. This too is with our weight loss surgery recovery. We know it's a journey, it's not a straight line. It really is supposed to be a lifestyle change, especially if you want long-term success. Being in the midst of it can be super rough, be it through trying to get through a pandemic or weight loss surgery recovery, or maybe even both. We're exhausted, we're depleted, and some of us are just numb. We want to hide under our covers and just not leave. Many of us also feel restless and even bored. Some of us, because of that boredom, because of that restlessness, we dream of making a big move, a huge life change, like moving across the country, starting a new job, date again, maybe even leave a relationship. We might feel all those things at the same time. We might feel super depleted, can't get out of bed, or restless and bored and want to make a big move. And we bounce back and forth, sometimes within the same hour, with these feelings, with these urges. And in addition, with being tired, it comes with a lot of emotions: angst, anger, depression, resentment, regret, and frustration. So, what can we do about it? Be it post surgery recovery, or maybe even a few or a year down, and now we're dealing with regain, and or kind of dealing with the pandemic flux syndrome. What can we do about it? It's important to understand the phases of crisis management. There's generally 3 stages: emergency, regression, and rebuilding. So the emergency phase. This is the phase where we respond with a lot of adrenaline and energy. So be it the pandemic, when it first started, we were in emergency mode. A lot of us did respond with a lot of adrenaline and energy, like, what should we do? How do we get this done? Where should we go? What's happening? Like, we were on like full blown energy, Mach 90. As well as after bariatric surgery, even if we had some side effects or whatever, we were kind of in an emergency state. Some of it started before surgery for us, but we were kind of like, we really had a lot of adrenaline. And I don't mean like you might have been tired and feeling lethargic after surgery, but you kind of had that energy, like you're in the emergency state, like, let's get this done. Why am I feeling this? Why do I have these complications? Do I need to go see my doctor? Like, it was, you're really, really working fast and furious. That's the emergency phase. Then there's the regression phase. It's kind of that stage of crisis management where we just don't have the ability to be our best selves. We kind of feel like we have a loss of choices. And disappointment, frustration, resentment leads to even less choices, more emotions, and kind of an increased intensity. Then there's the rebuilding phase of crisis management. That's when we take real purposeful efforts to build resiliency over time. A lot of us get stuck in the regression stage. Now, remember, different people work through these phases at different times, at different levels. But the goal is to work through the regression so you can get to the rebuilding phase. It takes grit, perseverance, and telling yourself, I refuse to go down that rabbit hole today, and I'm going to choose this. You really need to have an honest conversation with your inner critic. You need to ask yourself, is this thinking, is this self-talk serving me or getting in the way of getting to that rebuilding phase? Now, brain science tells us to move through crises, hardships, and or demands. Routine is very helpful in that. Stability means setting limits. If you need to feel like you need to cry, scream, yell, just feel bad, maybe you get 24 hours to do so, and then you have to move on. You're setting a limit. Just a little story about me and my husband. This was kind of before surgery, but we've really used it, definitely pandemic. And my husband had some real big health issues that he had to deal with, and some real life choices and strategies, and had every reason to feel bad, to feel overwhelmed, to feel like to give up. But we kind of told ourselves that what we needed to do is, if something happened, yes, you have every right. You get to deserve to feel bad, but you only get 24 hours. You can feel bad, you can do whatever you need to do, but then 24 hours, you wake up, you shake it off, and you start moving forward. Because if you let it pass 24 hours, it's just going to become a habit and it's just going to get out of control. So the best thing to do is that, and brain science supports it, your brain wants you to move. It's designed to move you through the crisis, not get stuck in the regression phase. And by doing that, you need to set limits. Give yourself permission to take care of yourself. How many of us don't give ourselves the permission to take care? We'll take care of everybody else in our lives, but we don't take care of ourselves. You need to give yourself permission for self-care. Grant yourself patience and grace. It's okay to not have all the answers. Have the courage to not practice avoidance. Trust your body, trust the process, even if you don't. Know you're not alone. Your feelings do not define your self-worth. Adapt and try to build your resiliency. Ask yourself, how can I be more resilient? And up your surge capacity. So ways to up your surge capacity, and I'll put the link to where you can get and look at this a little bit deeper. The information is from the Soul Center online. Accept that life is different now. Lower the expectations of self, but maintain your expectations of health. Recognize the flow of the grief process. Experiment with both and thinking. Do things new and old to fulfill yourself. Build and always keep building your resilience bank account. And focus on maintaining and strengthening and improving the most important relationships to you. What are some strategies that help you get through either the pandemic or post-surgery? Let's help each other out. Let's call it the post-op flux syndrome. Want some more strategies? Check out my playlist, Removing Roadblocks. Take care and see you in the next video.